How do you actually die from Parkinson's? And how is dementia related? Parkinson's and dementia are two different diseases. They will have their own progression. They're different diseases. But why do I bring them up together? I bring them up together because, number one, almost 80% of all patients with Parkinson's will develop dementia towards the advanced stages of their Parkinson's disease. Hence why being on hospice with Parkinson's disease or dying from Parkinson's disease looks almost identical to someone dying with dementia. Let's talk about it. Generally speaking, when I talk about Parkinson's or dementia, I am talking to you as a hospice nurse who sees patients like this at the very, very end stage. So there is a huge progression, 10 years progression sometimes, of the disease Parkinson's or the disease dementia that I am not talking about. So I want to be clear with that. I'm talking about only advanced stages. And one of the common symptoms that does happen with Parkinson's disease that doesn't necessarily happen with dementia, and this can happen early on in the disease of Parkinson's, is the person having delusions or hallucinations. That is actually a symptom of Parkinson's disease. Now, dementia patients also, as you know, can be agitated. They can see things and become restless. It is a little different because this usually happens with Parkinson's patients. It could be even early on in their disease. They actually develop delusions. They develop hallucinations. They start seeing things. It is a part of the disease. There are things you can do about it, and I've talk to Parkinson's patients who are not quite advanced yet that can say eventually they can tell when it's their disease. They can tell that they're having these delusions of like their wife stealing their wallet. And after it happens so often, they can start seeing, oh, that's my Parkinson's disease. They can actually decipher between. I only like to talk about it because it's a thing that happens a lot that's not very well known. The most common misconception or myth about dying with Parkinson's disease and or dementia is that the person starves to death. I have heard this countless times. We just let our loved one starve to death. That is not happening. What they die from is their disease. Parkinson's. They are dying from Parkinson's disease. They are not dying because they are starving to death. So let me explain how their death will usually look, how it progresses onto hospice, and what you can do to help them. Parkinson's and dementia look almost identical onto hospice. So what you will see with your loved one with Parkinson's, once they are advanced enough to be on hospice, is usually this. They are bedbound. They're usually nonverbal. They're usually sleeping a lot. They usually are not eating and drinking much, and they had a recent infection. They're prone to infection, UTIs, which is urinary tract infection, maybe aspiration pneumonia, which means they're needing to be fed. These muscles are weakening, so when they swallow, they accidentally swallow some particles of food into their lungs, and that settles, causing aspiration pneumonia. Very, very common. You don't even know it's happening sometimes until they develop pneumonia. They go into the hospital, they get a chest x-ray, and they say they have aspiration pneumonia. So that's usually what has happened by the time they come onto hospice. And generally speaking, with Parkinson's disease, as you know, they've had this for 10 years. They've slowly declined over 10 years. And at the very, very end, most people with Parkinson's disease, from what I have seen, are like not doing much. It is a long process, but the actual end is pretty gentle. There's not tons of pain. There's not tons of symptoms. It's mostly just the family caring for them, right? And allowing their body to be the guide. So you allow them to sleep 22 hours a day if that's what they want to do, as long as they're clean. Right? You offer them food and water. If their body can take it and they're willing to do it, great. If they're not, you allow their body to be the guide. And it's usually the slow, natural, gradual, peaceful progression where they're sleeping a lot, not eating and drinking, sleeping a lot, not eating and drinking. And then slowly but surely, they sleep all the time. And then their body will eventually go into the actively dying phase. And then they will look like anyone else with any other disease in the actively dying phase. So it's still a long, hard disease because you've been dealing with this for 10 years. But the very end is usually very gentle and not tons of symptoms. Like I said before, I am talking about Parkinson's in this video, but just so everyone here knows, dementia, Alzheimer's, any type of dementia, right? So dementia is the umbrella. Then there's Alzheimer's, there's Lewy body, there's vascular dementia. Parkinson's not under the umbrella of dementia, but all of those diseases, although slightly different, look the same at the end of life when you're on hospice. So how do you know when it's time for hospice with someone with Parkinson's disease? This is a disease that is harder to get onto hospice, just like dementia, just like Alzheimer's disease. You have to have a lot of these boxes checked in order to meet criteria to be on hospice. Because, as you probably already know, you can live a long time with Parkinson's disease. So how do you know when it's time? Number one, you can always talk to your doctor. The doctor that's working with your loved one, talk to them. Let them know that you're open to discussing this so they can help guide you and let you know when they think it's time. But if they don't and you want to know the things to look for, this is what I would say. When they're bedbound, right? When they're sleeping more than they're awake, when they're barely eating and drinking, those are some signs that could tell you maybe it's time for hospice. Maybe they would qualify for hospice. And the last thing, the really big indicator, I think, is when your loved one is in and out of the hospital a lot. So in and out because of falls, in and out because of infections. Those are the two big things. Infections and falls, I think, would be the big indicator. So if your loved one is very debilitated, meaning almost bedbound, incontinent, you have to feed them, if they've had an infection recently or been in the hospital a lot, if they're sleeping, 18 to 20 hours a day, not really eating and drinking, all of those are signs that this is getting end stage. And I would just ask your doctor to place a referral for hospice just to see, just to check it out. So the big risks with end-stage Parkinson's disease or dementia, I'm bunching them together again because they do look very similar and kind of present very similar, would be skin breakdown. So it's no one's fault if your loved one starts getting skin breakdown. So if you think about it, your skin is an organ. And if your whole body is shutting down, your organs are sort of systematically slowly shutting down, that means your skin is too. And your skin is not getting the nutrients it needs by no one's fault, except that it's just the nature of what's happening with the body. And it's not getting the regular blood flow and oxygen that it needs. So it can easily break down. Plus the person is usually laying down 24/7 or close to it. So it's just hard for the skin not to start getting breakdown. Sometimes people don't, it just depends, but don't feel like you're doing something wrong if your loved one starts getting skin breakdown. That is normal and almost to be expected at the end of life. And of course, we probably won't expect those wounds to heal, but we can try to help with them not becoming infected. Infection is another really, really big risk. So at the end of life for people with these diseases, a lot of times they'll get aspiration pneumonia. Like I said, they'll get UTIs, they can get skin breakdown, and then those can become infected. It's just a high risk thing that we want to look out for. And lastly is falls and or agitation. So they could be a little restless, a little agitated. I would say the main symptom I see, if any, with Parkinson's disease or dementia is restlessness and agitation. There's usually a lot more restlessness and agitation before they're on hospice or when they're not as close to end of life. When they're super close to end of life, they usually relax a lot more. So I don't always see it, but there is some agitation or restlessness, which can lead to falls. And falls can be a big thing because then they can break a hip or they can break an arm or a wrist, which can cause many issues, pain being one of them. So falls are a huge risk. So what can you do about all of this? How can you help your loved one? Well, being on hospice, one can help. So if you're on hospice, please utilize the hospice team the best you can and let them help you the best they can. If you can't get on hospice yet, or you are on hospice already and you're still like, what else can I do? What else can I do? I want your mantra to be clean, safe, comfortable. So you always think about, is my loved one clean? Is my loved one safe? Are they comfortable? So are they clean? Think about how if they're sleeping 22 hours a day and they don't really want to be touched, right? They might not be clean. So you will have to make sure while they're sleeping that they are still changed, they are still dry, they are still bathed at least a couple times a week. And if they don't like that, or if it's hard to do that, you may have to start working with a doctor to medicate prior so you can get that done. Because the one thing they do need to be is clean. The second question is, are they safe? What does that mean? That just means, like I said, they're high risk for fall, right? Because they may have some agitation, they may have some restlessness where they want to try to get out of bed, particularly if they had the personality of someone very fiercely independent, stubborn, prideful. They may be still in their mind like, I need to go pee, help me get out of bed. But they can't get out of bed yet. They can no longer do it. They've forgotten that they can't do it. So you're constantly trying to keep them in bed, right? Keep them safe. So that's another thing. Are they safe? Now, many times you're going to say, yes, they're sleeping in bed, they're great, and you don't have to do anything about it. The times when they're not safe is when you have to start leaning on your hospice team or leaning on your doctor. And that's what you need to say to your doctor. I don't feel they're safe. They keep trying to get out of bed. I can't physically keep them in bed 24 hours a day, right? So you have to think of either medication or training them to sleep at night, stay up during the day. There's different things you can try to do. It can be very, very frustrating. But getting a hospital bed, getting bed rails, keeping their hospital bed low to the ground, so if they do end up getting out of bed without you knowing or falling, they're not falling far. A lot of times too, we put like mats on the ground. So if they fall on this mat and not on the hard floor. So those are some things you can do. Generally speaking though, towards the end of life, it should be quite easy to keep them clean and safe. Because like I said, they're mostly going to be sleeping. And the last one is, are they comfortable? And a lot of times your loved one who has Parkinson's or dementia at the very end stage will not be verbal. So how are you going to know if they're comfortable? You're going to use non-verbal cues. So think of them like a baby. Babies cannot verbally tell us what they need and want, but when they do need and want something, they will cry, they'll be restless, they'll be fussy. That is how your loved one will also be. If your loved one is just laying there and sleeping and allowing you to easily touch them, easily turn them, they are likely very comfortable. If you touch them and they guard, right? Or they go, oh, they moan. Now, maybe one quick moan would not mean anything. It probably just means they're startled or something. But if you notice that when you touch them, they're really stiff or they really don't want you to move them, that could indicate that they're not quite comfortable. You want them to be comfortable during those turns, during the changes. So that's something to think about and possibly medicate before you do those things so they can be comfortable during changing, during bathing, things like that. But generally speaking, if they look like they're sleeping and they look comfortable, their faces, flat, they're not furrowing their brow or making like a moaning noise or a face that looks uncomfortable, they are likely comfortable. Your communication with your loved one will change. You probably have already noticed this. It's going to be mostly nonverbal now. So you're going to be looking at your loved one and noticing subtle differences in the way they are acting, the way they look. And if you think they look comfortable and relaxed, they likely are. So to sum all of that up, the mantra is, are they clean? Are they safe? Are they comfortable? If you can say yes, yes, and yes, you have done a good job. And you can take that deep breath and relax for a little bit. Now you may have to ask yourself that several times a day. Are they clean? Are they safe? Are they comfortable? Again, if they are, you can relax. You can always offer them food and water. If they want it, great. If they don't, it's okay. You want to allow their body to be the guide, and you are just there trying to be present and care for them the best you can. And again, if you ever have any questions, you can always call your hospice team.